And over the last several months, I really came to the realization and to the understanding as to how important the wearing of masks is in fighting this virus. I say that because the donation of the mask by the Federal Republic of Germany, and I want to really say thank you to the government and the people of Germany for the donation on behalf of Prime Minister, the Honorable Mayor Motley, and the people of Barbados. And as simple as this donation looks, it really is a very, very, very significant thing for us. And why? This is because it must be clear to everyone by now that COVID is not going away easily. It must be clear that we are fighting a protracted war. It has been going on and will continue for a while. And even though sometimes there will be sporadic battles or fighting, it is still a very present and dangerous enemy. And for a small island developing state like Barbados to be able to sustain this effort and yet sustain and do everything else that we are required to do as a government for the people of this country, and even for the Ministry of Health in providing all of the other health services, it is a monumental task for us.
Exposing an unprecedented health and economic crisis. The reported number of COVID-19 related deaths per 100,000 people is higher in these countries compared to other developing country groups and regions. In the countries served by PAHO's office for the Eastern Caribbean countries alone, almost 70,000 infections have been recorded and close to 700 lives have been lost due to COVID-19. The high prevalence of pre-existing health conditions such as diabetes, cardiovascular diseases, and obesity make populations in small island economies particularly susceptible to COVID-19. People living with these pre-existing conditions are more likely to develop severe symptoms from COVID-19. Most small and island economies lack capacities for the detection and treatment of the new disease, have relatively poorer health capabilities, especially with regard to the prevention and detection of and the rapid response to epidemics, as well as the ability to treat the sick and protect the health workers. On top of the health implications, the COVID-19 pandemic is projected to inflict the worst recession since the Great Depression.
Globally, newly reported cases of COVID-19 have now declined for 8 weeks. Deaths have declined for almost 7 weeks. This is good news, but new infection and death remain high globally. Last week alone, more than 2.5 million cases and almost 64,000 deaths were reported. That is 250 times cases for every 6 days every minute. I repeat that 250 cases and 6 deaths every minute. That is too many. The rate of decline in most regions has slowed, and every region has countries that are seeing a rapid increase in the cases and deaths. This is also changing. There are several reasons for this increase and also decrease in some places. The reasons are actually the presence of an increased variant of concern, more of social mixing, ineffective use of public health and social measures, and also vaccine inequity.